hit several different topics, some nutrition, some different workplace ergonomics, and obviously at home right now. So it's things that we can do while you guys are, sitting on Zoom and also, doing meetings that way. So kind of first start, we're going to start with some kind of workplace ergonomics. So it's going to be similar to work. So if you're at home, you should be at work being able to sit and stand. We love standing desk. So if you have a stand desk, those are awesome. Now, not everybody has that. So if you want to be able to vary your postures. Also, if you're at home, you want to have a good chair. So good quality office chair, something that puts you in a good position if you're going to be there for a long time. You want to be able to have something in your low back. So we recommend like a roll of paper towels or just a towel rolled up that you can put into your lower back while you're sitting there, and it kind of pushes your posture back forward into your low back. We have these little guys, they're little lumbar rolls. I mean, you probably can't see me, but they go in your low back when you take a seat in a chair, and it pushes your low back in, and just constantly correcting your posture. So we do like that. Like I said, we have the little lumbar rolls, but you can use like roll paper towels or a towel to kind of help you out with posture. You also want to be able to move your chair. So if you have an office chair that's got like a hydraulic cylinder on it, you can be able to adjust it up and down. So if, you want to be able to have both feet on the floor. That way you're not, if you're shorter trying to reach the floor, or if you're taller and your knees feel like they're up in your chest, that's not good ergonomics. Also, laptops, we'll start with computer screens. Computer screens, when you're sitting at your desk, when you open your eyes, your eyes should be about in the center of the screen or just above centers when you open your eyes, where you should be at in a good upright posture. With a laptop, it's a little bit differently. Now that most people are working at home, a lot of us are on laptops and not in front of a desktop computer. So with a laptop, you're just going to have to be able to adjust your screen and where your keyboard's at, either on a table or kitchen table or desk, to be able to get that eye kind of spot with your screen, and then also where your keyboard's going to be at. Let's do some demonstrations. Michelle's going to be our awesome demonstrator here, and we're going to actually kind of move over to the front desk so then you can see her. I'm going to try to flip this screen around and see if you can see her. All right. Oh, you get the dog. He's laying there fast on the floor. All right. So as Dr. Michelle is kind of sitting at the front desk here, she should be sitting in a good posture. Eyes, then again in that top side, middle to top of the screen. If you can adjust your screens, that's great. Feet flat on the floor, you can adjust this chair, kind of things that we'd just gone through. So if that kind of gives you a fair idea, good chair, something with good lumbar support, it's kind of what we're looking for. Anyhow, she's kind of sticking her jacket back behind her low back. That works very well if you're sitting there for long periods of time. Now, we all know that after about 3 minutes of good posture, we fall out of that good posture, and then we end up in a poor posture again. So you're going to try to constantly correct, and that's where like something in your low back does help with that. Also, if you're on the phone, so if you're not doing like these Zoom things where it's obviously on speakerphone, if you're on the phone more, you don't want to be like, doing this kind of thing. And I see a couple people already in there that have like the AirPod things. Those work great because then, you're not twisting your neck and in a bad position for long periods of time if you're on the phone for a while. Also, taking breaks. If you're working for several hours throughout your day, we say like an hour, sit there for an hour, change positions. So if you're sitting at the kitchen table or sitting on a couch, that one you want to limit as much as you can. You want to be able to constantly rotate your position, move spots, get up every hour, set an alarm, sit there for an hour, get your work done, get up for 5 minutes, move around, get a glass of water, that kind of thing. We are going to show some exercises here shortly. So then like maybe if you do take a 5-minute break that you can get up and get moving, get your blood pumping again, so you're not falling asleep, and stay focused. Also, with posture and work ergonomics, it's not normal to get headaches, tension headaches, tightness through the neck, low back, whatever it might be. So if that stuff's happening, you need to be able to take care of yourself, change position, get it looked at, whatever it might be. So then you can take care of yourself. I know we're going to cover some of those exercises here in just a few minutes. Michelle's going to go over some nutrition with you guys. So I'm going to kind of step aside and let her take care of that.
Nutrition, nobody wants to talk about it, right? All right, I'm going to sit down so I'm not moving around as much. So nutrition, some good just general tips are everybody should be drinking half of your body weight in ounces. That's kind of a good overall. If you're working out, running, doing anything that, it should be more than that, but just a good general. So for an example, if you weigh 120 pounds, you should be drinking at least 60 ounces of water per day. That's straight water. That's not tea. That's not coffee, soda. That's just straight water. That way your body doesn't have to break it down. It's water. It can go straight to what it needs to. Fresh food is really, really big. Some grocery store tips I kind of like is if you think of when you go to the grocery store, if you shop around the perimeter, that's where more of your fresh things are. So if you think about it, when you first walk in, whether you're at Hy-Vee or Aldi, what do you hit? The produce. If you keep going around, you'll hit meat. Then you sometimes hit eggs, then the milk and dairy. So if you go around the outside, that's a really good tip that I like to tell people. So that's your minimally processed food. Most of your processed food's in the center. Somebody told me the reason they do that is because they don't have to replace the center things as often, or they don't go bad as often. So the outside perimeter is easier to get to for the employees too. Let's see. Quick food is convenient, but you have to ask yourself, is it healthy? I'm not saying quick isn't healthy, but a lot of times, sometimes it isn't. Foods can be made quickly if you think about it and are slightly prepared about it. So if you guys are going to make tacos one night, let's say, use that for an example, make enough that you can feed you and your family for another night, and it's just a quick reheat over the stove. You can reheat meat really fast. Sauteed veggies, I'll throw veggies, whatever veggies you want, in a skillet with some avocado oil and some seasoning, and those can be ready in 15 minutes. So it's not healthy, good food doesn't have to take a really long time if we just think a little bit ahead about it. Read labels when you're at the grocery store. I started doing this a couple years ago, and it's amazing when you're like, oh, that looks like it should be good for you, and you flip over the ingredients, you're like, wow, that doesn't even think, that's not what I thought was in it. Another thing, just because it says diet, low fat, healthy, reduced sugar, doesn't mean that that's good for you either. I'm not saying it's not, but again, read ingredients. Oftentimes, if it's low sugar or reduced sugar or low fat, they add extra fillers that are sometimes, I would say, even worse for you. Tips for eating better: pre-make meals. Like I was saying earlier, think about it. I like to, Tyler and I on Sundays, kind of make a meal plan of at least the meat that you're maybe going to have for the week. So the night before, you can set it out and it can already be thawed. So when you get home to make dinner, it's already thawed. You don't have to try to wait 20, 30, 40 minutes for it to thaw. Let's see. Bring or make your own lunch for work. Obviously, we're all home right now, so it's not as big of a deal. But when we do go back to work, which we will eventually, bringing meals, or if you can run home at lunch so you can heat food up at home, that's a good tip too. Let's see. So I'm going to talk about some exercise tips at home. I know Tyler said that we were going to talk about that. So that's what we're going to do at home. We like to say every hour that you are sitting, take a 5-minute break. We always think, oh, I can't take a 5-minute break. I'm in the middle of something. If you're in the middle of something, finish it up. But it also gives your brain that quick break so you can sit back down and feel fresh about it and can go into working for another hour or so. So a couple things I really like to include, especially since you guys are at home, if your spouse is at home and wants to be included, or you have kids, you're trying to get work done, but you're also trying to entertain them. Some of these you can do with your kids a couple different ways. So an air squat I'm going to talk about is, Tyler's going to kind of work the camera for me a little bit. So an air squat is you want knees and ankles about hip width apart, and you'll kind of almost think like you're sitting back to a chair, and then you'll stand back up. That's in essence an air squat. You want your knees to stay straight and not dive in or dive out, and then from the side it'll kind of look again like I'm sitting that. Couple other options, like if you have infants at home and you want to hold them, you can do a squat with a little extra weight. They find it fun, and it gives you a break from doing what you need to do, what you're doing at work. Or if you have children that are a little older, they can do air squats with you. A lot of times if you watch an infant or a couple-year-old, they don't have to be an infant, one that can walk, so 1 or above, their squats are really perfect. They haven't had, most of them, injuries or predispositions to different things. So if you have little ones at home, watch them do a squat, and they're amazing at them. Another thing is a lunge that's really good. I'll back up a little bit so you can see. So a lunge is you can do walking lunges or just in stationary. So I'm going to just do them stationary. So you'll just take kind of a big step forward, and then you'll touch that knee to the ground. When you do that, you should have your knee kind of above your ankle, and I'll show it from the side, and then you can alternate. These are really good, and again, your kids can do them with you, or if they're little ones, you can hold them. From the side, when you do it, your shin should be nice and vertical. You don't want this because you have a lot shear on your knee, a lot of extra pressure on your knee, and it shouldn't be really far out. So when you do a squat and you come all the way down, it should be a nice vertical shin and vertical thigh. Some other things just to get your heart pumping and blood flowing, jumping jacks, everybody knows what those are. Walking or running up a couple flights of stairs, again, just to get your body moving. We were made to move, not to sit 8 hours a day in front of a computer or at a desk. Ball toss, I had a patient tell me about that. So their kids were bored, so they decided to do a ball toss with each other, or they actually, to keep their kid entertained, put an empty trash can and they toss the ball into the trash can. It gives them something to do, entertaining, and you can make it fun. Let's see. You can also, if you don't have a trash can, just make a mark on the floor with something and throw it to that. The other thing is you can jump, like do plate jumps or jumping to a target. So all that is I have a plate on the floor. Hopefully you guys can see it. Here, now you can. So again, just jumping up and down several times gets your blood flowing and gets you moving. All right. Let me see. Next, Tyler's going to talk a little bit about chiropractic, who we are, what we do, and then we're going to talk about and show some more exercises here after a little bit. So I will turn it over to him.
All right, I'm going to sit down also, so then hopefully I'm not like all distorted moving back and
I'm
forth.
going to interrupt for just a second. Does anyone have any questions on the various exercises Michelle talked about? Nope? Okay, go ahead.
Another thing with those exercises, so you can make like a little bit of a workout. So yeah, we talk about like air squats and doing these things like properly, but you can do like, okay, if you want a 10-minute workout, something simple, it's amazing how much you actually work you can get done in 10 minutes. So if you want to do like, set a timer for 10 minutes, do 25 air squats, do 25 jumping to like a target, or like Michelle was doing to that plate. You can do 25 lunges, stuff like that, and then you'll be surprised in 10 minutes of doing multiple rounds of that, of how much of a workout that actually will turn into. So that's where it gets blood pumping. It's a great overall exercise and stuff that you don't need equipment for. You don't necessarily need to go to the gym to be able to do simple stuff. And if you have dumbbells or a kettlebell or something like that, that's obviously beneficial, but you don't have to have that. All right, so some of the things that we do, we're going to hit on this real quick. So yes, Michelle and I are both chiropractors. We see a lot of musculoskeletal complaints. So that's, anything from headaches, neck pain, back pain, shoulder, rotator cuff injuries, sciatica, knee, ankle problems. So we look at those, we assess those differently. Musculoskeletal, looking at ranges of motion, looking at function. It may not necessarily be where the pain's at, but we're going to look at kind of the function to get you doing better. So we treat the issue, just not the complaint. In conjunction with chiropractic, we use acupuncture, dry needling. So some things with acupuncture is hitting different meridians. So if you look at like Chinese meridians, you see these diagrams of people with all like different points on them. That's going to be your Chinese meridian. So those can treat all kinds of different ailments. Also, we do dry needling, which is the same kind of needle, acupuncture needle, which is absolutely tiny. It's the size of a hair, to go into a problem area, to help it relax, help it heal up. We also do a lot of rehab exercises and therapeutic exercises. So then patients not only can do some stuff in our office that we teach them to be able to help them out, but also give them something to go home with, so they can treat themselves outside the office. So that kind of brings us into some of the rehab exercises that Michelle is going to demonstrate, and I'm going to try to talk about here. Some other exercise things that Michelle kind of hit on a minute ago, but we're going to go into some other ones. I'm going to kind of flip the camera in here, so if you guys give me just a second.
All right, would you get so I'm going to actually interrupt him really quick. So some of these exercises he's going to go over. So earlier I said the movements of babies and how they squat. So in our office, where am I at? Here we go. So I have posters of little ones and adults mimicking it, of their developmental progressions as babies go through. So some of these positions we're actually going to be talking about today, because it's really important for babies to go through this for specific progressions and how they learn and grow themselves. But then we can also do this as adults for rehab. So, all right, Taylor's going to talk and I'm going to.
In a lot of these exercises, these ones that we're going to show, and then also the ones that Michelle was doing earlier, it's sometimes not about the quantity of doing them; it's also the quality, and that's a big thing. Is quality, so you're making sure you're not getting injured. So we really like quality over quantity.
Brett's going to help me apparently.
Yeah, apparently he's going to hang out with us here. This is his favorite spot to lay, by the way. We have a lot of mobility and stability exercises. So some places in the body need to be mobile. Our shoulder joint, knee joints need to be mobile, but other areas need to be stable. Our shoulder blades need to be stable. Our mid back, our core needs to be stable to be able to move about our normal day and to be able to function. So one of the first things Michelle is going to go through is a little breathing exercise. So then again, this is
everybody can do this.
This one's simple, so you guys can sit there while you're in your chair. And do this. I'm going to try to focus the camera here. You get it on Michelle. Hopefully you can see with the blinds open. Yeah. So Michelle's got one hand on her chest, one hand on her stomach. When she breathes in, we want to breathe with our core. So when we take a deep breath in, we want to make sure that our stomach expands outwards. So air comes in, diaphragm goes down as it contracts to let air into our lungs. Our stomach and our whole core should expand outwards. So when we get good core breathing, we are stable within our low back. So this also helps reduce low back problems. So if you're bending down and picking something up, if you're moving a couch, moving something heavy, you should have that core stability and that core pressure with air pressure. If you're doing a deadlift or squat or something that is of more weight, we want to make sure we have core pressure, because if not, it will tear up a low back.
Another thing, so a lot of people commonly do that they were taught, or just we pick up bad habits, is you'll see people and as they're breathing, so I'm going to do this wrong, this is the incorrect way of sitting, and you'll see people breathing through their shoulders and through their chest. So if you watch their shoulders will move. So they'll be doing it, let's see if I can do it wrong.
So she takes a big deep breath in, like shoulders come up, chest comes out. That's where we don't want to be breathing. It's actually accessory muscles breathing, even though we think of that as normal breathing, but it is not. Our diaphragm is our primary muscle to breathe with. So we make sure we do core breaths.
So then this is better. So you can see my stomach coming in and out. Your chest can move out a little bit. That's fine, because your ribs have to expand as your lungs get air, but it shouldn't come up towards your face.
And this is a great one you guys can do. Like, if people are driving, sitting on the phone, sitting at a desk. I have people do this thing all the time. If you need a reminder,
hands on the wheel, and then your seatbelt comes here and seatbelt comes there, so you can think about breathing into the lower seatbelt.
Yeah. So being able to do this seated is easy. It's a good kind of technique. It's actually a good stress reliever too, because you're getting more oxygen to your blood, so it does help actually relax you. Another good a good exercise to do, which this can be also kind of a workout, is a bird dog. And Michelle's going to show this with a ball up against the wall. So we have one of these big exercise balls. Hopefully you can see that. Where she's going to kind of back up, kind of put her booty up against the ball, and then be able to be on all fours with her hands down in a good proper position where her mid-back, her neck are all in a nice straight line. From here, she can like raise an arm. Well, sorry, let me back up. She's going to slightly push into that ball, which will actually help activate your core, which seems kind of crazy, but you would be baffled on how much that does engage your core muscles. So when you do that, and then you go to raise an arm, so you're in good proper posture, be able to raise an arm like she's doing, is a amazing workout. And like if you do these 10 on each side, take 2 minutes and do these, baffling how simple that thing looks and how hard it actually is to do these properly. So it shouldn't really hurt, but it's a good exercise.
And you can also do it without a ball. So just because you don't have a ball, you can kind of
push your feet
heels a little bit into the wall. And then again, as he was saying, as I'm lifting an arm, you should not see a big shift in my hips or in my back. So I'm nice and stable. So if you think if I had a ball on my back, it wouldn't be moving. A lot of people, if they do it wrong, you'll see them have to shift. So that's not what you want to do.
All right, now we're going to move on to a 7-month sideline exercise. This one's a little bit more complicated, but it does, it works very well for a shoulder. So Michelle's going to, I'm going to kind of move the computer a little bit. No, you're good there. Okay. All right, so she's laying on her side. She's going to bring her arm up, so her left arm, you can kind of see where her watch is at, and then her elbow is going to go in line with her shoulder. And then her shoulders, she's kind of laying on top of her shoulders, so in a good posture. So you're not like rounded out or relaxed. You're in a very active posture.
Your shoulders are in line vertically, so I'm not laid back and I'm not forward.
So when she does this, she's going to drive that elbow down and then kind of bring her torso up. When you do that, it works the back of the shoulder. It works the core. If we talk about like that breathing that we talked about earlier with breathing in through the core, if you can do that, take a big deep breath in as she does this. Big breath in through her stomach, keeps her core stable. You don't see her core sag. And then doing that, so like her core relaxes there, and that's what we don't want. That's improper posture. Keep core nice and engaged. Drive the elbow down. Works the back of the shoulder. Works our oblique muscles. Amazing core exercise. Also very difficult. And after a few of these, you get a good workout in. And it's very beneficial through stabilizing the back of the shoulder blade. Michelle's also going to show a, let's do foam roller. So some people, if you have a foam roller, so these, you kind of see foam roller there. A lot of people have these. We know a lot of like our runner patients have these. They work great to roll different muscles, that kind of thing out. And she's grabbing a band here.
Sorry.
So a foam roller, if you have one of these things, some people kind of wonder like, okay, I have this foam roller, but I'm not sure exactly how to use it. As Rhett is staring here watching and maybe lay next to Michelle is on the table. Yep. She can use this band and go arms overhead, put that foam roller in her middle back, and then go over the overhead with her arms. Kind of there. So there we're getting a lot of good mid-back extension to there. So if we've been sitting for a long time, if you have a foam roller at home, this is a great one to be able to work the mid-back and kind of reverse that bad posture technique.
You can do this with a band. You can do it with a broom. If you have PVC pipe, or if you don't have any of that, you can still just do the same thing.
Just being able to come back and getting our middle back into extension, which is a great exercise. This is not necessarily like, this is a kind of more of a feel-good exercise than a wearing you out kind of exercise like some of the other ones have been.
And then if you want, some people want to roll up and back, again, you want to make sure you're rolling while you're relaxed in extension and not here.
As we tuck our head forward, that actually puts us back into a bad poor posture and bad flexion with actually overpressure, which is not necessarily good for us. Michelle's also going to show a seated banded pull apart. So this is something simple that you can do. A lot of people have these little bands at home. It doesn't have to be like this little green band that she has.
Any sort of stretchy band.
Some people have these like little TheraBands, little stretchy bands. If you have one, great. You can use it. This is an awesome exercise to use it for.
Can you see me?
There we go. You can kind of see Michelle. So you can do this one sitting down, sitting at a desk, something of that nature. You can put elbows on knees, back's in a good posture. You're in a active posture, so you're not slouching. Neck's in a good position, so not like that. We want to be there. So when you put that band in your hands, and Michelle is going to pull apart with that band. So leaving the elbows on the knees and then pulling side to side with each arm. Then again, great shoulder workout. Help stabilize shoulder blade, kind of like we talked earlier. We want to keep that shoulder blade stable.
And with this, I'm not moving my legs or my knees at all. It's all my arm doing. I'm just rotating my elbows on my knees. So if I come here, it looks like this. And then depending on how close you get your hands, the harder it'll get. So if you guys probably saw me at first, I had this band doubled. That was a little too hard for me, so I just went down to single band. And if that's too hard, you can still start with just your arms farther apart, because then that will have less tension. Or if you want it harder, you can put your arms closer together.
All right. I'm going to flip the computer back around here. There we go.
I guess one thing I will add, so like he was saying, stability versus mobility, a lot of people don't understand what that means. So I want to kind of explain it. If you just think of a rubber band, so when we have bad posture, what do? We're here all day long. So the back muscles are actually long and tight, which most people think that means, oh, if it's tight, it needs to be lengthened. We need to roll it out with a foam roller. We need to dig into it with a tennis ball, whatever. But when we're here, we really need to activate so we can stabilize our shoulders so we can come back here, versus when we are hunched over, we get muscles here are short and tight. And then those are ones that should be more lengthened versus back needs to be strengthened or stabilized. So if we need a good thing of stability versus mobility.